February leading up to this Friday, ABC 10 is examining UP hospitals and how they're trying to keep local patients from leaving the UP for their care. OSF St. Francis Hospital and Medical Group in Escanaba have about 700 employees between them. About 60 of those employees are doctors, and I have a look at what they're doing in part 6 of our series, Healthcare at Home. OSF St. Francis Hospital's number of beds is in flux at the moment. It'll go down this spring.
We've seen a decline in inpatient utilization over the years, and so we're adjusting our inpatient bed capacity to 25, and that'll actually provide some increased reimbursement for us from the Medicare program.
The change comes out of applying for critical access hospital status. That means a hospital is in a community more than 35 miles from the next nearest hospital. It has 25 beds or fewer, and it has an average length of stay of 4 days or under.
It's not going to result in much of a change to the current services that we're offering today, but it will be providing more adequate space in the rooms for visitors and family, as well as for our treatment teams to take care of our patients.
The hospital has invested in a centralized electronic medical records system.
As a part of some of the healthcare reform legislation, but also because it's the right thing to do, the ultimate goal is to break down the silos of information so that it's not separate information within our physician offices, our emergency department, throughout our different care units within the hospital. It ultimately ends in much better patient care.
And for other new technology, it was the first UP hospital to get a wide-bore MRI.
People who've had an MRI before, if there's a difficulty, some people have a real problem, especially with claustrophobic issues. Just that little difference in the circumference makes such a difference for people who have trouble with that, and they have a much nicer experience now and can really tolerate the procedure better.
About 5 years ago, hospital staff learned area patients were leaving in great numbers for obstetric care and gynecological care, but they've made changes since then. They renovated the OB/GYN and nursing area, and they hit the recruiting trail.
We have a very strong base of highly qualified, board-certified OB/GYNs now. We now have intrathecals for pain management. That's been just a wonderful new addition to those services for women who are in labor and delivery. Basically, it's an injection into the spinal area that just kind of provides some relief, some numbing for them so that they can really actively still participate in the birthing process.
But Lana Scannell says that isn't the only area in which the hospital excels that residents may not know about.
Among the services that we provide here at St. Francis Hospital that I don't know if everybody's aware of is our sleep center. We have one of the largest sleep centers in the Upper Peninsula.
It has 4 sleep labs, and it has the UP's only board-certified pediatric sleep specialist who can perform studies on sleep issues affecting kids. OSF Medical Group, to which the hospital belongs, is ranked among the top 100 integrated healthcare networks in the country, and OSF has received that recognition for 14 straight years. Mike Hoey, ABC 10 and CW5 News Now.